Hello and welcome to the World Physical Therapy Day. My name is Dr. Brent Anderson. I am a physiotherapist from Miami, Florida, and achieved my doctoral work at the University of Miami. And I just want to do a shout out to our friends and colleagues around the world in the physical therapy world. And I thought I would answer some questions that were asked to me from our friends in Asia and particularly in China. First of all, what is physiotherapy from my point of view? Well, I am a pathokinesiologist. I love that term. I learned it years ago from a leader in the physiotherapy world, Helen Hislop. She was the director of physical therapy at the University of Southern California. And she defined physiotherapy as any impairment or disease that impacts one's ability to move is my specialty. And I love that because I love movement. And in Polestar, we focus all of our energies on restoring movement and function. And so when I heard her say that 30 years ago, when I first came out of school, I fell in love with that term, pathokinesiologist. Any pathology that impacts movement is my specialty. What the mission of physiotherapists is, in my opinion, which goes along with that definition, is that we basically are responsible for being the movement experts in healthcare. And that we have to not only understand how normal movement is, but we also have to understand how pathology and disease, both physical and psychological, impact movement and wellness in our patients. Physiotherapists can prescribe in our country, and they can not prescribe medicine, but they can prescribe exercise. So one of the things that I've incorporated over the years is prescribing to our Pilates teachers and yoga teachers therapeutic exercises, both in the rehab and in the post-rehab realm in our prescription. So that's about as much prescribing as we do in the United States. We do have direct access, and each state in the United States is a little different. So what that means is that some you need a prescription from a physician to practice. That would be considered not having direct access. And others might have limitations of 30 days of treatment before you would need a medical or an MD consultation. So a couple questions that came up from this group. The first one was, physiotherapist is more a decision maker and manager than manipulator and executor. Now, in reality, you can choose how you want to use your profession. I think that there are many what we could refer to as shake and bake physiotherapy studios, where the patient comes in and they see aides or assistants, and the physical therapist is documenting the notes and basically prescribing the exercises. There are also very boutique physiotherapist studios where the physiotherapist does everything. So the physiotherapist does the manual therapy, does the exercise, designs the program, and even in the United States now, part of our Practice Act is wellness and health promotion. Another question was about COVID-19. Well, with COVID-19 came out, a lot of us as physiotherapists resigned to using telehealth. And so we were just like I'm communicating with you through Zoom. We use telehealth as a way to be able to diagnose, assess, and treat patients with movement disorders. And at first I thought that was going to be really tough, but now I have a vibrant practice where I see patients. Today I'll see 3 patients virtually online and am able to see and cue and teach and assess movement through the virtual telehealth. Now, COVID in and of itself has played a major havoc on many of the countries around the world and has made it so that there's an additional need for respiratory therapy as well as conditioning post-COVID virus. Another question was physiotherapists and working in the geriatric population. And again, we have a growing geriatric population around the world. And in the United States in particular, it's going to be the largest population, is over 65 years old. And we find that they have an increase vibrancy for life, like the average lifespan has greatly increased, and that people want to be more active in their 70s, 80s, and even 90s. And so it's very important that we as physiotherapists do not limit these individuals in their ability to participate. So in the International Classification of Function and Disability, we're able to identify what do these individuals want to participate in. And once we understand that, then we can design programs that can allow them to reasonably and safely participate in those activities. There have been many research studies that have shown that even over the age of 90, an individual's muscle, endurance, and strength can all increase and improve. It's just a little bit slower, but that we can be a major force in improving the quality of their lives. Another question was, are physiotherapists an educator who teach patients to teach how to do for themselves and who has responsibility to advocate a good lifestyle? As I mentioned, one of the big changes about 20 years ago in the physiotherapy world in the United States, and I believe worldwide, was to include in our Practice Act wellness and health promotion. Currently, I am a professor at the University of St. Augustine Physical Therapy Department in Miami, Florida, and I lead and teach the course Wellness and Health Promotion. And one of the things we focus on with our students is being able to teach them how important is it that we be an icon and actually not just treat tertiary disease, but that we prevent disease. And we do this by creating projects to do outreach into communities, to be able to make sure that they're eating properly, that they're exercising, that they're getting the attention they need as a preventative measure to disease and sickness. And so I believe wholeheartedly in our role as physiotherapists to be able to restore and to maintain health through wellness and health prevention, screenings, exercises, outreach, doing, one of the most popular things we could do is go out with young adults and be able to do movement screenings and seeing how they do based on what they want to participate in. We're in a sedentary world. Can we go into a corporate office and teach them exercises that they should be doing to avoid all the disease and impairments that are related to sedentarism? We often say now that sitting is the new smoking. Lastly, there was a question on how to operate a clinic and how to integrate physiotherapy with sports and health service program. For the past 30 years, I have successfully worked in a private clinic, my clinic, and have been able to integrate Pilates and therapeutic exercise and prevention in a cash-based model. I've also been able to work closely with the ballet studios in not only in my city, but also throughout the country to be able to provide consulting and to create programs that minimize the injury of the dancer or the athlete. And I think that very simply, we don't make a lot of money off of working with a special population like dancers or young athletes. But what we do is we establish a name for ourselves in the community working in these particular populations. And from there, we're able to treat their mothers and aunts and uncles and grandfathers who are full paying and do realize that we are very interested in providing the best health prevention and health maintenance that we can for the people in our community. I think that's about it. I would like to leave you with a thought, and that is that we are always learning, and the science is always changing. And one of my dear mentors, Dr. Carol Davis, said that much of our work starts out as witchcraft, and then it becomes clinical. And then as we submit it to the rigors of research, it becomes evidence-based. I would say that as we can identify and use our language correctly as to what is a causative problem versus what is a correlative problem, and how do we use the language properly to say that certain types of interventions are going to be clinical at best right now. They have not been submitted to the rigors of research, and we should communicate that clearly and honestly with our patients and our peers, and then take it upon ourselves to see if we're seeing that it works clinically, shouldn't we submit it to the rigors of research so that we can, again, disseminate this information worldwide of things that actually are evidence-based and can really help the lives of millions around the world to restore their movement. Wishing you the very best, and keep focusing on restoration of movement and function. My name again is Dr. Brent Anderson. I am the founder and owner of Polestar Pilates, and I look forward to seeing you in the future.